According to the Institute of Child Health and Human Development, Down syndrome is a set of mental and physical symptoms that result of having an extra copy of chromosome 21. Normally, a fertilized egg has 21 pairs of chromosomes. In most people with Down syndrome, there is an extra copy of chromosome 21, also called trisomy 21, because there are 3 copies of this chromosome instead of only 2, which changes the body's and brain's normal development. Even though people with Down syndrome may have some physical and mental features in common, symptoms of Down syndrome can range from mild to severe. Usually, mental development and physical development Usually, mental development and physical developments are slower in people with Down syndrome than those without the condition. Intellectual and developmental disabilities (IDDS) is a disability that causes limits on intellectual abilities and adaptive behaviors, which include conceptual, social, and practical skills that we use in everyday life. Most people with Down syndrome have IQs that fall within the mild and moderate range of IDDS. They also may have delayed language development and slower motor development. Some common physical signs of Down syndrome include flat face with an upward slant to the eye, short neck, and abnormally shaped ears, a deep crease in the palm of their hands, white spots in the iris of their eyes, poor muscle tone and loose ligaments, and small hands and feet. There are a variety of other health conditions that are often seen in people with Down syndrome, which include heart disease, hearing problems, intestinal diseases, eye problems, thyroid dysfunctions, and skeletal problems, and many more. Down syndrome is not a condition that can be cured. However, early intervention can help many people with Down syndrome live productive lives into their adulthood. Children with Down syndrome can often benefit from speech therapy, occupational therapy, and exercise for gross and fine motor skills. They might also be helped by special education and attention at school. Many children can integrate well into regular classes at school. When developing lessons or classroom methods, there are 4 concepts to keep in mind: inclusion, self-esteem, distraction, and talking. Inclusion. Strive to make our classroom a place where students, regardless of age or level of intellectual ability, feel a part of the group and comfortable with interaction with other classmates. Encourage students with Down syndrome to talk and interact positively with other students. Teaching them to feel comfortable in their environment helps to boost their confidence. Self-esteem. Due to facial differences with children with Down syndrome, it is important for them to feel attractive and proud of their appearance. Teachers can utilize praise to help them feel good about themselves and help change their attitude within the classroom. Distractions. Students with Down syndrome generally suffer from short attention span. They are easily distracted by the simplest things, such as light on the wall or a fly on the desk. In order to engage these students, it is important to break the lesson into chunks and remind them to stay involved and cut down the lesson into time constraints. Talking. Students with Down syndrome often have difficulties talking clearly. It is important to practice clear talking skills and to be coherent. Make sure that they have the ability to talk clearly and talk clearly with them as well. Keeping these in mind, teachers can strive to utilize as many verbal and visual cues, use organizational tools such as charts, mnemonics, diagrams, and as well as breaking tasks into small steps. While having students repeat directions, use a teaching sequence, use methods to limit visual stimulation, provide transition time between content and activities, and much more. Creating modifications for students with Down syndrome when thinking about the FFA ring of agriculture education is to ensure simple tasks that can be repeated so that specific students can have a sense of value when participating. Possibly in a chapter meeting, you can allow a student with Down syndrome to be fully in charge of the sign-in table, allowing them to make sure that every single student signs in, and that will be their job. As for events, conferences, and other high populated activities, ensuring that the visual stimulation does not overwhelm the student and making a variety of accommodations such as providing a schedule for the student, provide extra time to wait, provide notice between transitions, and many more alterations depending on a specific student.